Presidency, Ashanti Regional Minister, Minister for Health and Member of Parliament for Doma Central, the Minister for Local Government, Decentralization and Rural Development and Member of Parliament for Okre, the Minister for Works and Housing and Member of Parliament for Bantama, the Deputy Minister for Defense and Member of Parliament for Etrima, Members of Parliament, CEOs of state agencies, Nana Echina Kwejain V, the representative of Asante, Nana Nubi Fra III, Tredehine, the General Secretary of the New Patriotic Party, Ashanti Regional Chairperson of the New Patriotic Party, residents of Trade, fellow Ghanaians, ladies and gentlemen. The animal about the Kwaya Cabrofo, where do my why? The idea of fucking a Falenina, a Yabia, no Bia Chichino. It's one of the Kwaya, Madden or Potomo. Today is a happy day for Mother Ghana, and I'm glad that it is under my tenure as President of the Republic that the biggest ever investment in the nation's health care is being made. We are met this morning because of the ravages of COVID-19, which has affected every country on the planet. For us in Ghana, not only has the pandemic disrupted our daily lives, but it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Indeed, in update number 8 of the Fellow Ghanaians series, I indicated that COVID-19 has revealed the unequal distribution of healthcare facilities in the country, as we have tended to focus our healthcare infrastructure in Accra, Kumasi, and one or two of our other big cities. As we have seen, epidemics and pandemics, when they emerge, spread to any part, can spread to every part of our country. We discovered that there were 101 districts in the country with no district hospitals, and we had to do something about it. The creation of the new regions also meant the government had to construct 7 regional hospitals for the new regions, including a new one for the Western region. See to the construction of 2 new psychiatric hospitals for the Middle Belt and Northern Belt respectively, and rehabilitate the Efian Kwanta Hospital in the Western region. This led to the formulation and declaration of Agenda 111. Following on from this initial announcement, a lot of work is being done to help make this vision a reality. And I'm delighted to be here with you in Trede to cut the sword symbolically for the commencement of construction of these hospitals across the country. So far, 88 out of the 101 sites have been identified, including this one at Trede, the site for the construction of the Etrima District Hospital. Work on the other 87 sites also commence today. The acquisition of the remaining 13 sites will be completed shortly for work to begin. Each hospital is being constructed at a cost of $16.88 million United States dollars. That is $12.8 million United States dollars for construction and $4 million United States dollars for medical equipment. All the hospitals are to be completed in 18 months. Work will commence on the regional and other hospitals in the latter part of the year. These modern, fully equipped state-of-the-art hospitals will have facilities for outpatient services, including consultation facilities for medical and surgical cases, ophthalmology and dental services, a physiotherapy unit, maternal and child health unit, public health unit, 4 state-of-the-art surgical theaters for maternity, obs and gynae, accident and emergency, and for general surgery and imaging facilities. In addition, each hospital will have the full complement of male, female, pediatric, and isolation wards. Provision has been made for support facilities, which will include a kitchen, laundry, sterilization department, mortuary, energy center, maintenance department, and staff accommodation for doctors, nurses, and other health workers. Ladies and gentlemen, Agenda 111 has been carefully thought through to inspire activity and growth in various sectors of the economy and also help bring jobs to the youth. It is a Ghana first agenda, and the following facts will help make the point. Firstly, a consortium comprising some 20 Ghanaian consulting firms made up of architects, civil, structural, electrical, and mechanical engineers, quantity surveyors, biomedical engineers, and other technical teams have designed these hospitals to reflect our unique domestic requirements, including impact of climate, sociocultural conditions, and traditional practices. They will also supervise the construction of these hospitals, which will be built by some 250 domestic contractors and maintained by domestic facility management professionals as part of government's policy of developing domestic capability in the building and construction sectors of the economy. This will undoubtedly help retain most of the money in the country to engender further investment in the economy. Secondly, the hospitals are of standard design and construction to provide a blueprint for speedy and cost-effective implementation of future health infrastructure programs in the country. Thirdly, the execution of Agenda 111 will require significant domestic inputs, which will give impetus to private sector investments into the one district, one factory policy. I expect Ghanaian entrepreneurs to take advantage of the opportunities provided by the significant investment and produce quality building and construction materials required by the hospitals. Fourthly, we have incorporated into this agenda a strategy of direct and indirect job openings to stimulate the economies of the various communities in which the facilities are to be located. These include the creation of an estimated 25,000 jobs during the construction and design phase, i.e., jobs for architects, civil, mechanical, electrical and biomedical engineers, quantity surveyors, masons, carpenters, welders, steel benders, painters, tillers, and related professionals and artisans, as well as other indirect jobs. Once completed, it will provide job opportunities for some 20,000 health professionals. And that's enabled the Ministry of Health recruit more doctors, nurses, pharmacists, and other health professionals. In addition to these, there will be many indirect jobs for residents in the local economy. For example, for persons who will sell food, drinks, hospital consumables to the hospital, its staff, patients, and visitors. I am confident that this important investment will have a positive impact on many lives and livelihoods in the respective communities. Ladies and gentlemen, beyond the building of these new healthcare facilities, my vision is to help make Ghana the center of excellence for medical care in West Africa by 2030.
Thank you, God bless you.
Leveraging on Ghana's favorable status in the region as the most peaceful country in West Africa, a beacon of democracy of the continent, and a land of opportunities. This we will achieve by investing more in the development of our healthcare infrastructure, mapping our regional health facilities to specializations, as well as upgrading selected facilities in our regional and teaching hospitals into world-class standards. Excuse me. India and South Africa have shown the way in this regard. The relevance of this is reinforced by the fact that West Africa by 2030 will have a population of 500 million people. The goal is thus to position Ghana as an attractive medical destination with excellent medical facilities for our neighbors to patronize. Several countries benefited from international medical travel. Benefits to these countries include enhanced GDP growth, improved healthcare infrastructure, foreign direct investments, tourism promotion, and importantly, halting the brain drain of skilled medical professionals. Indeed, research has shown that in 2016, for example, Africans spent some $6 billion United States dollars on seeking medical treatment abroad, of which Nigerians, our great neighbors alone, were responsible for $1 billion of this. In order to take advantage of the huge potential for medical travel, we began during my first term in office a program to revitalize healthcare infrastructure in our premier hospitals. Investments were made in the Kolebu Teaching Hospital in Accra to build a new 400-bed maternity and gynecology block, and a new 100-bed urology and nephrology center of excellence. Government will build on this foundation and include 2 additional projects currently in the planning stage, namely the Trauma and Acute Pain Center and a new surgical service block with modern inpatient facilities. These major investments in the Kolebu Teaching Hospital will contribute to its transformation into a modern world-class teaching hospital. Further investments are being made in the Akufo-Addo Teaching Hospital in Kumasi, beginning with the new 550-bed maternity and children block, specialized centers for infectious diseases, orthopedics, cancer treatment, cardiovascular health, specialist eye care, among others, will be assigned to some of the regional hospitals, including those to be constructed under Agenda 111. Whilst we upgrade facilities, we should invest in medical education and training of our health personnel, including expanding the use of IT for medical diagnosis and treatment in the Agenda 111 healthcare facilities being developed. This network of primary, secondary, and tertiary healthcare facilities will form the backbone of the vision to make Ghana the leading healthcare destination in West Africa. It is envisaged under a public-private partnership that the Ghana Medical Corps, a volunteer corps of medical specialists, which will tap into the skills and resources of Ghanaians and non-Ghanaians locally and abroad, using IT and telemedicine to support the delivery of healthcare and training, will be established by 2023. This will offer in particular to Ghanaian medical experts resident outside Ghana the opportunity to give back to their motherland in ways that will support and expand healthcare delivery. All these programs collectively will position Ghana as a medical travel destination in West Africa, with the potential to add some $2 billion United States dollars to the nation's GDP by 2020, and in the process, create some 50,000 jobs in the sector. The implementation of Agenda 111 will be a huge undertaking, requiring commitment, cooperation, and diligence on the part of all: government, professionals, contractors, traditional rulers, opinion leaders, workers, and residents of the various communities to enable it succeed. We owe it to each other to prove that we can do it. Let me conclude by thanking the various stakeholders, especially the hard-working project coordinator and consultant, Kwame Nyako, and the conductor of the orchestra, my redoubtable chief of staff, Akufo-Addo Opare, who have worked tirelessly to enable this project take off and remind all of us that we continue to experience the effects of the third wave of the pandemic. It is important that we continue to adhere strictly to all the protocols and directives government has put in place to protect lives and livelihoods. Continue to wash your hands under running water. Use alcohol-based sanitizers, hand sanitizers. Wear a face mask and ensure social distancing. These are the weapons of our welfare as we strive to reach the target of vaccinating 20 million Ghanaians, i.e., the entire adult population. I'm very hopeful that by the grace of God, we are on the threshold of something remarkable in Ghana. And I expect that within the next 18 months, God willing, we will all be alive and in good health to witness the commissioning of these hospitals. May God bless us all in our homeland, Ghana, and make it great and strong.
A round of applause for the President of the Republic, Dankwa Akufo-Addo. All right. Amapayi yabatinas na sene na nama achina kwejan okaino project yesa se na mo for